Thank you for watching another episode with myself, Emma Kirk. Plus News TV is proud to have here with us today Ali, and he's a podiatrist and chiropodist. We're going to be talking a little bit about diabetes and how you can best look after yourself.
Yeah.
Thank you for joining me.
It's a pleasure to see you, Emma, and yeah, why not? It'd be nice to just give insight of information regarding diabetes and stuff.
How long have you been doing this as a job?
It's been about 5 years now within the podiatry sector of it. So I worked in various parts of it, so within different trusts, and you understand how they work with diabetes and stuff. So it's quite, it's been a good experience so far.
Did you always want to do a job with feet?
No, I don't think I did. It was more to do with sports and biomechanics. So when I was in college, I just kind of fell into it. The more I got into it, I think since I graduated, I've just been doing more contracting work, which is kind of what I like more. So now I see when I want to do work, or I can back off whenever. So that kind of fitted my kind of role, and I've enjoyed it so far.
Society generally now has got an increase of incidents with diabetes.
Yeah.
It is a problem that we're seeing, but it's not just about blood sugar levels, is it?
No.
You know, the feet are really quite an important element of that.
Major.
Yeah. What kind of things do you see with a diabetic patient?
Well, within our sector as a podiatry, basically, if you're a diabetic, I think the feet are quite a big fundamental part of managing your diabetes, because people tend to forget if your diabetes is not under control, and if it goes over the high blood sugar level, what it does, it has an impact on your nerve endings and can cause damage to that.
Okay.
So if that leads to sensory loss, and then feet are quite a big major part where they tend to lose sensation. They're not sure if they're going into any sharp stuff might go into the feet,
of course,
or if they're next to a radiator, put their feet on there, they could cause burning. Or if they're going on holiday and the surfaces are really hot, they can cause burns, which probably they might not be able to feel, but when they come home, blood all over. So these are kind of stuff that you do tend to see a lot.
So that's almost like an accidental damage that, because of a sensation loss.
Yeah.
What about the blood supply? Does that get affected?
Yeah, it does. It does have an impact within the blood supply. So it does link in with the circulation and stuff. So it can cause, with the peripheral arteries being impacted. So it can cause circulation prevention. So when you are diabetic, that's why they say that it can cause delayed healing processes.
Right.
So that's an important factor that you've got to be aware of, with infection spreading, when the healings are not there. So it's very important to try and take these on board before, if something does happen, if they are aware of these risks, they can minimise these chances of occurring.
I've seen quite a lot of things, available in Boots that it says, if you're diabetic, don't use this.
Yeah.
So, I mean, presumably that would be because of that kind of thing.
Reaction to it.
Possibly you don't notice if the water's too hot in a foot spa, that kind of thing.
Yeah.
So if you got an injury and you were a diabetic patient, and your healing is reduced in the speed of which it happens, how can you best look after that?
They definitely take on advice on what the podiatrists say. So, for instance, if I was to see someone in clinic with an ulcer, what we do is we have to put, there's a guideline that we've got to follow, which is called NICE guidelines, and these are the kind of steps that we have to take. So if you did come into clinic with an ulcer or say something in that regards, we have to put that in place where we redress the wound, and the patient has to keep it dry, keep it clean, and these are things that they have to do themselves and try and rest it much as they can, so it helps that heal over and stuff.
Okay, so if I know I have diabetes and it's quite newly diagnosed, what can I do to help myself to possibly not have these problems?
Well, you need to, first of all, we provide leaflets for patients to tell them not to walk around barefooted. It's important. Or when you're checking your footwear, make sure there's no sharp stuff in there. Little stuff, but these little things, they go a massive long way in preventing ulcers, and so that kind of minimises these stuff happening. So when checking for hot water, don't check it with your feet.
Yeah.
It's little things that you've got to be aware of. It massively reduces this risk, because we see them day in, day out that them are the kind of stuff that people forget, and the simple things. So that does what leads to more or less big problems within their feet.
I suppose shoes and footwear are actually quite important to protect and cushion the feet. Is there anything you would suggest that would be better
100%. Again, footwear, like certain footwear which are too narrow for you.
Yeah.
If you have got like altered deformity within your toes and stuff, or even bunions, which is quite popular with females, definitely you'll see that. Honestly, you see loads of them, and that again, because it's too narrow for you, and if that causes a lot of pressure and friction on the skin, it can cause like hard skin to build up, which then can lead to ulceration. And if it does lead to an ulcer, then you're still wearing the same shoes, it's just gonna go from one problem to another, because you're not adhering to like certain stuff that's been told, and it's more of an ego thing that comes into place. So yeah, it's one of them really.
I don't wear the high heels.
I mean, because you're still young and stuff, so you do it. It's about that thing, where you don't want to wear wide shoes because they might not look stylish and stuff. So it's about having a balance. You can still wear them, but if you're going to wear them day-to-day routine, like for work and stuff like that, maybe just take into that consideration. If you're a diabetic, footwear is very important.
Yeah, very crucial.
Yeah, very crucial in that sense.
I'm going to ask you, is there anything that you see commonly, like that would be easy for somebody to go, to Boots or something, and get that sorted with a like a piece of foam or
for bunions or?
Yeah.
There is, but main thing that it comes down to is footwear still.
Insoles
do help in a sense, but it won't really help the bunion because the bunion's already deformed about that. So what you need to do is take in consideration how your foot is shaped, and a footwear which is a wider depth. You can get like toe forms, which are like stuff that you can put on the bunion, which provides protection. And now I think there's loads of like bunion protectors out there. So there are little devices that you can use to minimise risk with bunions and stuff.
But somebody like yourself would be able to make something a bit more bespoke.
Okay, you can, but they're quite minimal in that sense with orthotics, unless there's a more functional support that's needed within the feet. With the bunions, obviously, it causes them to become a lot more spread out, taking more depth. So we can make certain insoles to provide more adequate support around the arch, which is needed. Yeah. Okay,
so going back to the diabetes, if I have diabetes but I'm not at extreme risk of having vascular problems or neurological, how often should I be seeing somebody like yourself?
Well, annually is quite good, which means that you can see them every 6 months or 3 months.
Yeah.
That's just come and have a check over. And what that involves is in that check over, they check your pulse, your circulation within your